what are the tools or the questions that you give or ask of patients in order to help them along that pathway? Because I totally agree that changing beliefs and internal narratives is very, very hard. Just one quick example that meshes with the physical health realm. I have a friend and colleague. He's a very accomplished scientist who was very overweight for a long period of time. He finally made some behavioral changes that allowed him to lose, I think it was in upwards of 80 pounds, a significant amount of weight, felt much better, looked much better. He just delighted in his ability to do that, but then started to reveal to me that he was deathly afraid that he was going to lose control and start eating the way he was before and stop exercising in a way that would return him to his previous weight and feelings of malaise. And I said, well, all the things you're doing are in the direction of health. None of what you're doing speaks to the possibility of this all crumbling. This was the dissolve into a puddle of my own tears kind of narrative, but at this point coming from him. And he just said, I know, but despite doing all the right things, I'm still incredibly afraid that it's going to happen. It was as if the beliefs and the internal narratives hadn't changed, despite the fact that he was engaging in the world differently and more positively. I haven't checked in with him recently to find out where he's at with this now, several years later. He has kept off most of the weight, not all of it. He gained a little bit back, but he's still far healthier than he ever was. So hopefully he's experienced some relief. But, what do you tell a patient who is saying, I've got this loop in my head that tells me I'm not good enough, or that even when things are going well, they're going to return to that state that I fear so much once again. This kind of like, lack of agency, right? Just lack of agency, lack of empowerment. What sorts of practical tools can one give themselves or that you would provide to somebody?
No matter what is behind what's going on in that person's mind, it's addressable. But you don't know what it is and how to address it until we ask the question of what's going on inside, right? So if he's afraid that he's going to gain all that weight back, right? And he has a history that if significant negative things happen, he throws self-care to the wind, right? Then we'd come at it through that pattern, right? Because he would have he'd have a good reason to be worried, right? Because this pattern of something bad happens and I don't take care of myself for 6 months, and maybe someone, I'm just making this up, and maybe someone in his life is ill or he's fearing a death, in the future. Just something that would say, that's a very legitimate fear to have, let's talk about that. Let's look at where that comes from, right? What got that person into that pattern in the first place, right? By understanding the pattern and by working together, right? Can we stave that off, right? But it could be different. The person might say, well, I'm having a lot of food cravings, right? And we're like, okay, well, what does that mean? Where's that coming from? Or maybe he's depressed, and he's getting depressed, and when he's depressed, he can't stop eating more, right? So, you would look, or it might just be plain old fear, like this is so good, right? That I'm worried it will go away, right? Then we might want to reinforce, like, okay, like you're a person who's able to use circumspection and perseverance and preserve goodness, right? So like you do that and you do that really well. So let's make sure we're doing that here, right? So, a lot of times a person is worried, but that worry is coming through the lens of health, like they're healthy, right? So then we look at, okay, can we soothe that worry? Where's that coming from, right? We can come at it and reinforce the positive. But if there is something negative, there's a trauma-driven cycle, there's depression, there are cravings, we can understand that too. So I come back to this idea that there's answers to just about everything, and in a very regimented scientific way, it's not that hard to come to them, right? Just like in physical medicine, like we have the tools that we need to bring to bear, but you have to understand the person. Again, if you come in and say, I'm not feeling good, and someone else comes in and says, I'm not feeling good, the doctor better not do the same things, right? And says, how are you not feeling good? Okay, let me understand that, and then let me map that also to you, whatever underlying state of health you may have or diagnoses you may have. The same is true in mental health. If we just apply that, then it's remarkable the good that we do, which I've seen very consistently across 20 years of doing this, not only in my own practice, but like who are the people who do really, really well trying to understand and take care of people, including sometimes not doing too much and realizing like, hey, this person is okay. Like there's a state of health here, but this person is worried. How do we reassure them, right? How do we help someone living a good life live a better life, right? If we're going to do all of this, we have to approach people as individuals. It's just, I mean, the science tells us that and common sense tells us that too. But if we do that, a person can get to the place they want to be.